Welcome, welcome, everybody. This is a moment of truth. Today, I'm going to be your host. I'm Dr. Shapiro. I'm the medical director for health education and wellness in AltaMed, and here I'm here as a physician, as someone that actually is very interested on making sure that our future generations actually have a better future. And one of the things that we can actually do sometimes is talk about allergies and talk about food. We all have this part of our bodies that actually need nutritional things, and sometimes for genetical reasons and a lot of things that we're going to be talking today, our body changes, and we need to adapt to that. But now we have other things that, with the new guidelines from the Allergies Association and everybody else in the world, especially here in the US, we know that we can actually make a difference, not just in the child's life, but in the entire lifetime. Then that's why we are actually bringing today these amazing panelists and experts. We have amazing people from the community that have created amazing foundations to make sure that we're creating that conversations with our community, and most importantly, change lives. Then I'm going to just name a couple of our amazing panelists. We'll have Dr. Spergel. He's the Chief Allergy Program Manager over there. You can see him somewhere on the bubble downstairs, from the Children's Hospital of Philadelphia, and author of the new AAAAI guidelines. One of my favorite doctors that I cherish a lot is Dr. Kraft. She's past president of the American Academy of Pediatrics, also an amazing friend, pediatrician, and amazing leader. She's working currently as a pediatrician and does a lot of advocacy work in Children's Hospital in LA. It's a pleasure to actually be on the same zip code. And we have Dr. Gupta, professor of pediatrics and medicine of Northwestern Medicine, and has more than 15 years of experience as a board-certified pediatrician and healthcare researcher. I was also in Chicago, by the way. We also have Dr. Mark Kogan. She's owner of Clear Allergy. She's a board-certified pediatric and adult allergist, and also the co-founder and chief allergist for ReadySet Food. That she's going to be part of an amazing conversation. We have other panelists that have been trying to change the world in different ways. We have innovators, and we have a couple of amazing, and we're going to go next with you, but I'm waiting for you in a couple of seconds. We have Dr. Tay. He's part of the Allergy Power co-inventor and chief medical officer, and allergist and immunologist from Murdoch Children's Research Institute. And you will say, where is that? Well, it's Melbourne, Australia. Then thank you so much for being with us today. And Javier Evelyn, he's over here from Allergy, founder and CEO of co-founder of MedTech Color, advisory board of member and food allergy and anaphylaxis connection, that is called FACHE. And of course, we couldn't be doing this without the effort of all the people that actually conjoined their energy to actually and donated for this event, and making sure that we're creating that synergy of making a safer world for our kids, and especially changing their lives. And now I want to just share a little bit about what Daniel and ReadySet Food has done right now, and especially the donation program that they have. As part of the growth of ReadySet Food, they're very invested in communities that need help. And as we know, and we'll be talking about social determinants of health in our communities, it's extremely important to actually close the gap between communities. And one of them is actually making sure that our low-income communities get access to opportunities, education, and medications in any way or sort of form, to make sure that we are avoiding, a lifelong problem with food allergies and everything that it's actually come with that. Right now, the only answer that we have is making sure that patients are there at the front line, parents on the second line, physicians, and of course, payers, as a conjoined effort to make sure that we're doing the best thing and putting all the energy that we have out there. One of the high-level things that we're going to be talking is with Dr. Spergel. He will be talking about, the USA guidelines and, what is changing, what's the new roles of all the things that we have. And of course, we will have an amazing brief conversation with Advocate Aurora that, how they are actually implementing absolutely everything. And right now they have been actually reaching more than 36,000 babies a year. Then, let's see, put everything together and have an amazing conversation on that. Saying that, I really want to invite someone that has done a great deal for our communities, making sure that we are educating our communities and making sure that we're managing food allergies. Becca and Michael Suhi, from the founders of Allison Rose Foundation. They're going to be talking with us about their foundation and why it's important for them, and why are we doing everything that we're doing in their foundation. Take it away, Rebecca and Michael. Welcome.
Thank you, Dr. Shapiro. Hi, everybody. My name is Rebecca Suhi, and I'm the co-founder and executive director of the Allison Rose Foundation, joined by my husband and co-founder as well. We created the Allison Rose Foundation to change the lives of food allergy families through education, awareness, research, and advocacy.
Hi, my name is Michael Suhi. Like Becca said, I'm co-founder of the Allison Rose Foundation. I'm also a firefighter paramedic, been doing that for 25 years. I'm fire chief of Cuyahoga Heights Fire Department, which is in Northeast Ohio, just south of Cleveland, Ohio. As everyone knows watching, or they will know now, that 1 in 13 children live with a food allergy. Our daughter Allison, pictured here, was one of those 13. When Allison was diagnosed over 20 years ago, we were given the action plan that if she ingests her allergen, to give Benadryl. We carried an auto injector and obviously avoid that allergen. Allison accidentally ingested her allergen a few times. We'd give her Benadryl and it worked. Her allergy never defined her. Allison went off to Ohio University in Southern Ohio in 2017 to study early childhood education. It was the happiest we ever saw Allison down in Athens. I was fortunate enough in November of that year to go down for Dad's weekend and spent the most amazing Friday and Saturday with my daughter. Said goodbye to Allison on Saturday night. Didn't realize it'd be the last time I was with her. I received that phone call that all food allergy parents dread. Allison was having an allergic reaction. And for us at that time, it wasn't a big deal. I said, give her Benadryl, she'll be okay. Then I heard the word CPR in the background. At that moment, my family's life and mine forever changed. I met Allison at the med center where she was brought by paramedics. And I was given that talk that I'd given to many families before, that you never want to receive. Allison was unconscious. The decision was made to have her airlifted to Columbus, about an hour north of Athens, where unfortunately, due to the lack of oxygen, Allison lost her life. On the drive home, Becca and I decided we wanted to do something to not only honor Allison, but also try to prevent this very preventable tragedy from happening.
And as you can imagine, we went over and over what we could possibly do to make sure that no other family experiences the tragedy that we did. So after about a year, we thought long and hard, and we launched the Allison Rose Foundation, and with our first initiative of developing a physician-driven, evidence-based food allergy curriculum that could be mainstreamed. And with our amazing 8-person medical advisory team, which includes Dr. Katie Marks-Kogan and Dr. Ruchi Gupta, we launched that at the end of 2018, where we engaged firefighters and paramedics to be our instructors, because as we thought about who could be the perfect people to educate students, faculty, and staff, they are first responders, they are medical professionals. I like to say they have an element of celebrity. When they come into a classroom or a school, people will stop and listen. And they were the perfect people to do this. And so we have we've done more than 100 presentations to middle schools, high schools, and colleges and universities, to students, faculty, and staff. And prior to us coming in for a curriculum, we ask everybody to participate in the Allison Rose Challenge, where every student is assigned a food allergy and they have to live with that food allergy for a few days prior to us coming into the classroom, offering them the opportunity to be more engaged and involved and have a better understanding of what it's like to live with a food allergy. And most recently, just in January of this year, we passed a law in the state of Ohio called the Allison Rose Act, where all school districts are encouraged to create food allergy training for students, faculty, and staff. Also part of this act is that all teachers and faculty will receive continuing education credits for having food allergy training. And the Ohio Department of Education is required to share with schools what epinephrine autoinjector manufacturers do provide free EpiPens or AviQs to schools. So that was a big initiative in our 2.5 years of being part of this foundation. And we like to say that this is just the beginning. We're really excited about what we have planned for the future as well. So
we just want to again thank everyone for having us today. It sounds like it was hard to hear us. You can learn more about us at the AllisonRoseFoundation.org. You can go to our website, www.AllisonRoseFoundation.org. And I always like to say this when we give our presentations and we present our education, that I truly believe if this education was in place for the people without food allergies that were with Allison that night, she'd probably still be here today. And the stuff that you guys are going to learn about today is going to help save lives as well. So thank everybody. I want to thank everybody for doing this. It's an amazing thing you guys are doing, and we're just happy to be part of it. Thank you guys so much.
yeah, thank you.
Rebecca, Michael, thank you so much. And it puts a perspective of why are we here and how can we actually move forward with this. Sometimes we just see numbers, sometimes we hear stories, but actually hearing family members that have passed through this and it gives a different level of importance and urgency of how to act. And thank you so much for sharing that part. And we're here, and we'll continue to do the good fight for that one. Right now, part of the conversation is, we know why we're doing that. That's our mission. How are we going to translate that? Then I'm going to invite Dr. Spergel to actually have a conversation with me right now. I'm here in LA. The temperature is very cold. It's like 65. And he's right now in something called Philadelphia, that they have something called snow. And Dr. Spergel, I have a question for you. I have read the important new guidance about food allergy prevention from the AAAAI and the American one that you can, and you actually co-authored last year. Can you give us a summary of the key takeaways for all of us?
Sure. I mean, so first of all, I feel bad for Rebecca and Michael. It's a really sad story, and I wish we had better outcomes. And I think it's important not only to learn how to treat food allergies, but prevent, which is what we're really going to talk about now. It's how to prevent food allergies. And I'm talking now not only as an allergist who worked on these guidelines, but also as a parent with someone with food allergies. The guidelines really have shown taken sort of what we've learned from the hallmark LEAP trials and the E trials, and there've been several other ones now, what really have said that we really need to introduce foods early. The key is to prevent, even more than anything else. So if we can prevent food allergies, that's the most important thing. And that really what we've taken from these new guidelines, which we've been working on for many years, and these are sort of all constantly being tweaked, but is to really give all children, whether or not you're at high risk or not, food early. Really begin to do with that early introduction. And it's not just peanut, which was the LEAP trial, but the main foods, milk, egg, and peanut. And more recent studies, which came out after the guidelines, even show now cashew too. So all these foods are important to give early on. That's really, I think, is the key, is just to give babies foods early. You don't even need to screen them. The whole point of screening them is probably not necessary, and it really ends up being delayed. So you really just want to give foods early, and just let them eat. Stop worrying. Let the kids eat.
Thank you for that, Dr. Spergel. And you're right. And one of the things that we have as parents, and I hear a lot in my practice is, many parents think that breastfeeding is enough to prevent food allergies, or that early introduction will reduce breastfeeding. What do you know about data, and what do we know about this regarding breastfeeding and food allergies?
So those are really important questions, because that was a major concern by lots of people. Oh my God, we're going to give foods early, but my kid's not going to breastfeed so much. They looked, and it had actually no effect whatsoever. So the breastfeeding does not change. I know that's a big concern of most pediatricians. So the amount children breastfeed, based on sort of how much you can do, it really doesn't change when you do early introduction. So that means really the same amount. And the other part of your question is, just breastfeeding prevent food allergies? Unfortunately, it does not. It really has not been shown to prevent food allergies. Breastfeeding is really important for many other things: better bonding, smarter kids, less infections. I can go on for an hour about it, and I won't. And you as pediatricians know that even better. But it's really, breastfeeding is useful and it's wonderful, and I can't say enough good things about it, but it doesn't prevent food allergies, unfortunately.
Thank you for that. And and on the paper that you wrote, it's very clear the guidelines that we need to follow for parents and actually for pediatricians. Your paper also has a great recommendation for provider and payers. That one thing is the theory, and the other thing is actually the people actually that will carry this and teach it, like providers and payers. Can you tell us more about what role providers and payers play in preventing food allergies?
Sure. Providers, it's much easier for me to talk about providers than payers, because payers, I'm a pediatric allergist. I really think about providers and patients. Payers, I'm an academic, so I don't worry too much about payers, but I'll give you 2 cents on that in a second. But what we've done as providers is teaching our families to give food early, at 4 months, 6 months, really learn that on as early as possible. I mean, what we've done at my institution is create dot phrases such that the pediatricians can put it in the after verse summary. We worked with the folks at Aurora Health, Advocate Aurora, so I messed up the name there, I apologize. There's one there, there's one at preventallergies.org. There's a lots of them out there. Having those dot phrases in the after visit summaries, having those things so families know that, hey, because families always ask, what am I supposed to do? What am I looking for? What signs am I worried about? Having that there is really helpful for families to do that, helping with early introduction. In terms of the payer side, I mean, the paper, and I'll really defer to much more of there's a whole science behind that, but it comes out to about $13,000 by just adding foods in early. So a kid with eczema. Of course, you can prevent food allergies, and they look at the cost of preventing whether it's quality of life, and epinephrine use, and hospitalizations, and emergency room visits, all those things. So early on, I mean, saves money, right? It's a win-win for everybody. So it makes sense to do. So it makes everyone happy. So there's really no downside.
Thank you for your answer. And one of the things that we have is that we're fighting a lot of history here. And in the old days, like probably 2 or 3 years ago, we were like, do not touch all those allergic feeding stuff. Don't touch milk. Don't touch this. Don't touch that. And can you tell us more about, in one of the papers that you co-wrote, it tells about the safety of early allergen introduction as parents and pediatricians. Can you tell us a little bit more about that topic?
Sure. I mean, there's 2 things. One is our advice that we gave everyone 10 years ago was wrong, and there was no science behind it. It was just sort of a best guess. And we realize now with science and all the controlled studies that earlier is better. So the question is safety. Do we see severe? So the question is, obviously, you can't give honey to a baby because of risk factors and certain things, a choking hazard, right? But in terms of anaphylaxis, which is our study, what we looked at whether or not kids would get anaphylaxis. Do infants get anaphylaxis, and do they have severe reactions? And then what is interesting to find out is they really, the younger infants, particularly under the age of 1, have really mild reactions. And we looked at the food fatality registries in the United States and in the one in the UK, and there's no fatalities in infants. Infants rarely die of it. It is unfortunately a disease where the fatalities occur in the teenagers and young adults, and that's where it happens. And this unclear, I mean, I can go on for a long reason why, but it's the infants are safe. So if we can prevent those tragedies by doing foods early on, it's great and it's safe. We don't see that. The reaction seems to be much milder in young infants and toddlers than as you get older. So it is safe, it's easy, and it prevents food allergies. It's a simple thing to say, and that's why not only the allergy societies recommend it, but including the USDA now is on their new guidelines as well.
I'm very, and I would add, and very tasty. That would be the other thing that I think that I would add to that list. Thank you so much, Dr. Spergel, for actually spearheading a lot of the new wave of thinking, and that is evidence-based, that will be creating a new wave of pediatric teaching, and most importantly, like health in our communities. Right now, I'm going to introduce a great friend, local, Dr. Colleen Kraft, right now, and we're going to talk a little bit more on we already saw the front line, and who actually gets hurt when we do not act. And we already know the theory from Dr. Spergel. Dr. Colleen Kraft actually brings, that practical face and feeling of a pediatrician in the community on how we recommend things, how we do that part. Then, Dr. Kraft, a pleasure as always to see you, and I'm almost ready. What challenges have you seen taking food allergy recommendations from theory to practice?
One of the things that you always see as a difficulty is change. So if this is what you've recommended all along, you wind up having to really change the script to make things different. So it's when do you talk about it? How do you talk about it? What if the parents don't ask about it? And so the way that we look at doing this in practice and implementation is to develop your scripts. At what point in time is your script going to talk about nutrition and talk about allergy prevention? How are you going to say it in a way that families will recognize it? And that's very different. Some families do great with a handout. Other families, it's a lot more effective to say, at 4 months, grandma was right. It's okay to go ahead and give them these foods, because what we know now is that if you introduce these foods to their gut, it's going to prevent allergy. But you find with your population and with your different parents, what's the best way to give that message? When's the timing to give that best message? And that's how you make change in your day-to-day practice.
I love the answer, because that's one of the things that I think that, it changes. We feel that we have changes all the time, but this is one of the ones that, as pediatricians and family members and community members, we need to put attention on that part. And my second question is, since implementing the guidelines is hard for both pediatricians and parents, what can health systems do to help make food allergy prevention a reality? And this can include, like from teaching residents, with the stuff that we were hearing about high schools and teaching teachers. And any feeling where do we supposed to be going to?
Well, I will tell you that the most impactful teachers on food allergies are our families. So we heard from the Allison Rose Foundation, Rebecca and Michael, and having you present this to physicians, to residents, to trainees, to nurse practitioners is actually the most compelling call to action that we have. And so at that point, then you have your designs and how do you get information into phrases in your electronic medical record? How do you come up with the phrases that you use? And how do you pinpoint if you can do one thing differently? Let's look at that 4-month checkup. Let's talk about nutrition there. Let's talk about introduction of allergens to the gut at that point in time. And then let's talk about how do you promote allergy prevention, which is introducing foods through the gut, and how do you prevent it by not introducing allergies through your lungs or through your skin. So you talk about dust mite prevention, you talk about not smoking. So those are all of the things where if you can get that packaged so that goes into the 4-month visit and you promote that and you look at ways that your physicians are actually saying this and documenting it, you can actually get it done.
Thank you so much. And I think that that's eye-opening for all of us, where, right now I see the faces of a lot of the parents right now that like, yeah, try peanut butter. Like, what? Like, what do you mean with that? Then it actually opens interesting conversations. Then, Dr. Kraft, thank you so much for that. And I think that's actually the package that we have. Right now, I want to introduce an amazing doctor, Dr. Ruchi Gupta. And Dr. Gupta, thank you for coming with us. Right now, last year, you published an important research on how prior food prevention allergy guidelines are being implemented by pediatricians. Can you tell us more about your research, please?
Sure. Thanks, Ilan. So our research was really looking at pediatricians, very similar to what Colleen just mentioned, trying to better understand some of those basics. What are the barriers for pediatricians? What is their knowledge around the guidelines? And how much are they implementing it? And as Colleen mentioned, it's a very busy time. Those 4- and 6-month visits, parents are really concerned about so many other issues. So how do pediatricians make the time to really educate about early introduction? In our study, which was a national study of pediatricians, we found that only 30% of pediatricians were reporting using the guidelines fully. And of course, it was self-reported, so that is probably the highest of, the numbers. So if 30% are doing it, we then ask, well, what are your barriers? And, some of the key barriers are exactly that: time, knowledge around the guidelines. And the third one was parental resistance or caregiver resistance to the guidelines. And so we know the 3 areas we need to address. And our next step was to start a study to do it. And that study we call iReach. It's an NIH-funded study where we are going into pediatric clinics and creating a clinical decision support tool in their note template for 4- and 6-month visits. And that is going to hopefully save them time by helping them know what to do, how to assess risk, and then what tests to order and how to refer and when to refer to an allergist. And so we're very excited about that study. The other thing the study is going to do is really better understand, what LEAP found. So LEAP was an incredible landmark study, but now we're bringing it into 10,000 US infants, and we'll be able to know how these guidelines really work, what are barriers in specific groups of people, in the underserved, in the low income population, in different racial and ethnic populations. And this is really exciting for us because, as we know, it's never one size fits all. And how do we get to those caregivers and those families to really make them understand how important prevention really is?
Thank you so much. And you have also done great research on the impact of food allergies on lower income families. And you were starting to show us that part. How do food allergies affect those in lower income families?
So that's such an important question. I actually got into this space 16 years ago after studying asthma disparities. And when I got into food allergy, I was really curious, what do we know about disparities within food allergy? So that has been a focus of my research, over the past decade. And what I can tell you, what we found is that there are disparities in food allergy, just like there are in asthma and eczema, and a lot of the conditions that make up this atopic spectrum. And in food allergies, we did find that Black children have higher rates of food allergy than white children. And even Latinx have certain higher food allergens than white children. So we are understanding this better from a disparities standpoint, and we need to continue that. Another study we did an economic study looking at the economic burden of food allergy in the US. And we found, overall, it was $24.8 billion a year. But when we actually looked at the disparities and some of the main cost buckets, which are, one of the biggest out-of-pocket costs are special diets, right? Because you need foods without your allergen in it to keep your child safe. And then another big cost is medications, and a big cost is visits to the doctor, and another big cost is emergency department visits. So what did we find? Well, we found that underserved, low-income families spend significantly less on special diets and medications and specialty visits. So they're not getting to an allergist. And they spend 2.5 times more on emergency department visits. So they're having those reactions. They may not be getting diagnosed with it because they can't get to an allergist, and they're spending less on the special foods they need or the medications they need. Another study we recently published found that children that go to the emergency department, low-income children, have epinephrine given to them half the time as higher income children. So they're not getting epinephrine prior to going to the emergency department. So, we are seeing this very clearly. And what can we do together to improve this? One thing as we talk about, early introduction of foods, we're starting a study. We're fortunate to be working with FAIR and starting a study to see if we can introduce additional foods into infants' diet to prevent some of the other more common food allergens. So we are planning on introducing 8 common allergens to infants in that first year of life, and see if we can then prevent additional allergens from developing. And one of our big goals in this study is to make sure we understand how this works in a much more diverse population. So we do know that when new guidelines come out, they tend to trickle down and impact low-income children, especially last. And how do we change this? Because in food allergy, it's a condition we know impacts underserved communities and Black and Hispanic children at higher rates. So how do we make sure the prevention guidelines get to them, help them incorporate it so we can prevent food allergies from ever developing in everyone? One of my favorite quotes is by Maya Angelou, and it says, "Do the best you can until you know better. And then when you know better, do better." And I feel like this really resonates with prevention, because here we've been doing the best we can because we weren't really sure, maybe it's better to avoid, but now we do know better, and it's up to all of us to do better for all children, but especially those underserved minority children.
Thank you so much. And it's really impressive that this is the time for us to do better. And that's the way that we are doing that part and making sure that and I was following a lot of the questions from Lisa and Scott. Thank you so much for your conversation here and the questions actually for us here in the panel. I agree that when you actually put everything in context and you create actually a public health policy in a matter that makes a difference, that actually can get farther away. And I have worked in underserved communities in Chicago, Florida, here in California, and I agree with the pain of seeing the advantages of life-saving things that they at the end that they go actually to underserved communities, and we're seeing right now with the disparities with COVID-19. Then it's very close to my heart. Right now, I really want to invite someone that I met actually pre-COVID, BC, before COVID, Dr. Mark Kogan. She's actually the chief allergist for ReadySet Food, and she's going to be talking about the donation program and a lot of things that we have here. Dr. Mark Kogan, what is ReadySet Food, and why did you decide as a private practice allergist to spend time developing this type of things?
Hi, Elon. I just want to say before I answer that it really is an honor to be here with all of the panelists. And so to answer your question, I'm a clinical allergist, and I spend a lot of time educating parents about childhood food allergies and the science behind prevention. And most of my families understand and accept early allergen introduction, and they're actually eager to do it. However, a few years ago, I noticed a pattern amongst my patients that implementation was just too difficult. Introducing allergenic foods in the right amounts and the right frequency is really hard, and it's not for the faint of heart. And we know that introduction is just step one, right? So parents have to maintain exposure of these allergenic foods in their baby's diet for many months. And this difficulty was borne out in the clinical trials. Compliance is an issue. In one of the main clinical trials, more than 50% of the families could not comply with the protocol. And in full disclosure, I had trouble doing allergen introduction with my first child. And so I felt that if I had a hard time as, an expert doing it, then there was a real need to create a product that could help parents. And so ReadySet Food is a game changer. We make it very simple for parents to introduce allergenic foods to their babies early and often. We created a powder of peanut, egg, and milk that dissolves in breast milk or formula in a baby's bottle so that parents can give their babies allergens during that critical immune window when we have the opportunity to steer the immune system towards tolerance and away from allergy. We also use the exact doses and ingredients that were used in the clinical trials so that families could feel really confident that they were following the guidelines without that added stress of DIY.
Thank you for that. And and as you know, I work in a federal qualified health center, and I have been working with underserved communities for a while. And hearing all that stuff sounds great, and the process is awesome. But how can we actually get that type of things to the community that actually needs it?
Great question. We started ReadySet Food, to help as many parents as we can. So that's why we launched a donation program last year that allows us to give our product free of charge to all families on Medicaid. So being here on this panel is, wonderful and gives us an opportunity to publicize this giving back program and to connect with hospitals and healthcare systems who want to use our product and donate our product to their families, their lower income families, so that they can help them follow the guidelines on early allergen introduction. And so to that end, if there are any members in the audience who want to help us donate product to families in need, please reach out to us at lauren@readysetfood.com. And if anyone wants to find out more information about the Giving Back program, you can go to ReadySetFood/giving back.
Thank you for that. And you already heard that, that's actually solving part of the equation right now with something that it's new. One of the things that we're having is, the part of education. We already heard our experts that, implementing and putting the education part of that, it's hard. How can you help actually support the growing awareness about the new food allergy prevention guidelines?
So I'm an allergist by training, but I believe also an educator at heart. And we know that the science is telling us that today's epidemic of rising food allergies is somewhat, if not highly preventable, if parents have the opportunity to learn the science and follow the guidelines. So if we can teach one family about early allergen introduction, and thereby we can save one child from developing a food allergy, then I think it will all have been worth it. And so ReadySet Food allows us to take those tools that prevention and education tools and combine them. And with that, I feel that we can make a real difference on public health. And so to that end, we created an entirely non-branded educational program that we've already launched system-wide at Advocate Aurora Health Systems. And the program makes small changes to those after visit template summaries for the well child exams at 2, 4, 6, and 9 months. And we've created dot phrases for high-risk babies, like babies with eczema and a family history of food allergies. And so now that the guidelines explicitly, recommend that providers implement these educational programs, we've been in talks with multiple other health systems as well. And so again, if anybody here, in the audience would like information or, is interested in implementing this non-branded educational program in their health system, please reach out to us at lauren@readysetfood.com. And you can find more information about the educational program at readysetfood.com/Advocate Aurora.
Thank you so much for that, Dr. Marks Cohen. And that actually puts us in a different wave right now on a solution, something that we have right now, and that's actually tangible. And then we have other three different groups that are actually, I call them the pediatric allergy innovators, that will be talking with us. And they're kind of the next generation of things that we can actually start solving more of the problems that we have in our community. I want to invite the Food Allergy Fund right now to tell us a little bit more about how are they actually, a little bit more about food allergy, and most importantly, why are you excited about 2021?
Great. Thanks so much. We're so excited to be part of this wonderful panel. So I created the Food Allergy Fund 2 years ago. I have a 5-year-old daughter with multiple food allergies. She was tolerating foods until about 13 months, and then a switch flipped and she had her first anaphylactic reaction. And as a parent, I was getting very frustrated that I couldn't get answers. And what I quickly realized is we don't have answers. We really need to continue focusing on funding research and showcasing innovation. I'm a lawyer by training. I've spent the past decade working in media and PR. So short of going to medical school myself, I figured the way that I can make a difference, and to reference Dr. Marks Cohen quote, so we can do better, is to really bring the community, the research community together, and the innovative entrepreneur community together. And so that was really the genesis of the organization. We're a nonprofit dedicated to funding research across the country and around the world, focused on the underlying cause of food allergy. If we can get to a better understanding of what is causing this, then we can prevent it from even happening in the first place. And as food allergies have skyrocketed over the past 10, 15, 20 years, research dollars have lagged behind. And so that has been our primary focus, is how do we drive research, drive attention to it, and also showcase innovation. We host summits twice a year where we try to find the most innovative companies and researchers from across the country leading the charge and affecting change for the population. We had the pleasure of hosting ReadySet Food and Allergy 2 years ago before they were superstars. And so part of our goal is really to surface that research and innovation that's happening early on, so we can shine a spotlight and drive funding towards it. We're entirely volunteer staffed by design. We have an amazing network of volunteers across the country. And the reason we do that is so that 100% of donations can go directly to research. And we, in terms of the research that we fund, we really focus on collaboration and innovation. We've funded projects ranging from the world's first fecal transplant trial to most recently an inverse vaccine. We're all talking about the COVID vaccine, but we just funded an inverse vaccine for food allergy, all of which collectively is to figure out what is the underlying cause and how can we get to a better place for children and adults alike.
Ilana, thank you so much. By the way, I love your name, by the way. I don't know if you see my name over here. Thank you for that. And I agree with you completely that someone actually said very tightly, no money, no mission. then it's very important to actually to combine, the effort and passion that we have with actionable things and create things. And thank you so much for the things that you're doing for our community and actually shedding the light on amazing things that on the things that we're talking right now. Right now, I'm going to jump with Javier from Allergy. Javier, thank you for being here with us. One of the things that we want to hear from you is to tell us a little bit more of Allergy and what's it fun and interesting and energetic that you're going to be doing from 2021 right now.
Yeah, so thanks again. This has been an amazing panel. I've been taking notes, so many wonderful stories and so much information. I'm a patient entrepreneur. I'm somebody actually that suffers from a lot of food allergies myself. So cashews, pistachios, casein fish. And also when just reflecting upon Dr. Gupta's talk around just underrepresented folks, Black and brown folks, I'm at that intersection. I'm an Afro-Latino. So I grew up in a household that played everything from Celia Cruz all the way to Aretha Franklin, right? So I have a unique set of experiences that led to the innovation that we're all about now at this point. Ultimately, our innovations rooted in proactive patient-driven design, right? First and foremost, we wanted to kind of, growing up, I have a lot of family in medical, so I feel like this is like a family reunion to a certain extent as well too. Mom's a nurse, aunt's a doctor, et cetera. So what we're doing first and foremost is building a redesigned epinephrine auto-injector for greater portability, right? Still the first line of defense to make sure that you can go from brunch selfie, life is great, to, oh my God, they put a pistachio in my dish. And just in a few moments, you're just taking off your device for calling 911 dispatchers and sending the right folks so they know where you're at and what you're allergic to and how to save your life, really amplifying the food allergy action plan that's out there to just put it in real time in IoT. On the other side, I'm from Chicago originally, but we're a Detroit-based company. And I got my chops as an innovator working on multiple applications all about improving quality of life, right? So we have a HIPAA-compliant food allergy-specific application geared towards preventing, hopefully, you from having to use our innovation in the first place. So really, what gets us excited is, what we've talked about. We see regulatory submission in our purview. Finally, we've done a lot of work and had a ton of support from everyone on this call. And beyond that, we just want to make every moment count. Ultimately, I've had scares from, personal scares to hearing a lot of the conversations through talking with different patients, caregivers, kids, et cetera. And we're really excited for some upcoming innovation. I'll send our link later on today, but we're looking at complementing more upstream innovations going towards OIT support, as well as ensuring that for all the adults that are starting to get a lot more allergies. I've had, of my 4 allergies, about 2 of them came in my late 20s. So it's one of those, that's why I really appreciate the work that ReadySet Food's doing and all the panelists on this call to make sure that we have multiple ways to treat things. So what keeps me up, basically just the 220 million people worldwide. So beyond that, whatever we're doing in the United States, we are thinking about amplifying in the EU very soon. Fingers crossed, we should be presenting some big news very soon. So yeah, we're patient entrepreneurs and we want to just improve the lives of those folks that we all care to serve at this point. So thanks again for the opportunity.
Javier, thank you so much. You portray the action-driven advocacy that we need to do at every level. You're the patient and also the part of the solution. Then thank you so much for your efforts. Last but not least, we took some time because it goes all the way to Australia. We are right now going to be talking with Dr. Tay regarding my Allergy Power. Thank you, Dr. Tay, for being with us. Tell us about Allergy Power and what are you trying to solve with that?
Well, thank you very much, Ilan, for this fantastic panelists. It's great to be here. I want to thank actually Rebecca and Michael for sharing that really powerful story about Allison Rose. And 8 years ago, I'm a clinician, pediatric allergist, immunologist here in Melbourne, Australia. And we've had 2 patients we've had to counsel when they have lost dear ones due to food allergy. And with this in mind, wanting to prevent severe anaphylactic reactions. That is one of the key reasons why we've built Allergy Power. I mean, the research tells us that when a patient has an accidental reaction to a food protein, many of them, even though they do carry an epinephrine autoinjector don't know actually when they should actually be using it and how they should be using it. And this is and the delay in using the epinephrine autoinjector is the number one key reason why we see those tragic food fatality reactions. So with that in mind, we here at the Murdoch's Children's Research Institute created Allergy Power. Now, Allergy Power is basically a digital allergy management tool where you will know and be educated in carrying an action plan wherever you go. So we built Allergy Power so that every family with food allergy knows exactly what to do with their child when they're having food allergy reaction. The Allergy Power app will allow you to key in what symptoms your child is having, and it will instruct you as to whether your child is having anaphylaxis or not, and then provide instructions on how to use the epinephrine autoinjector. So that is really one of the key features of Allergy Power. That's V1.0. We've got visions on V2.0, where we could potentially have it as a digital allergy platform innovation, so that every symptom or every food allergy profile for every child can be provided, that you do want to let your allergy specialist know, can be brought onto the platform, and it could be an early detection tool. So for example, if we do know that adolescents with poorly controlled asthma has a high risk of having food anaphylactic reactions. We know that, but sometimes we don't have the systems to detect that. So if we have a 6-monthly check-in on top of you regularly seeing your family physician, your primary physician, and your allergy specialist, on top of that, build on top of that, we have a systematic way to check in to say, hey, how's your asthma control going? And if there's any signs that the asthma is becoming a little bit uncontrolled, for example, if you're using your salbutamol inhaler, twice a week or more, that's a red flag to say that maybe it's time to get that checked out, because that's a risk factor for having a bad anaphylactic reaction. So we're very excited about where we're at, and where we're going to go.
That's actually awesome. And one of the things that we have had right now is that sometimes it's hard to share the information, right? You get all the information and you change providers, or you need to do other things. And is there any way that you can share the same profile, allergy profile, with other people?
Yeah, absolutely. The whole idea is that we educate the patients. We want our families to be safe, and we want them to be safe and confident, not safe and anxious. So, and a big part of that is education. Carrying your action plan everywhere you go is important. And number two is when you hand off your child on a play date, or hand it off to grandfather, grandmother, is really, really important that they know what to do, because often we do know that 50% of food allergic reactions occur outside of the family home, either at school or at a friend's house. So these allergy action plans will be easily shareable with somebody else, just with a simple click of the button.
Thank you so much. And right now we're moving to the last part of our conversation. And before I go, Dr. Tay, I know that the world is so tiny and the internet is helping a lot. Is there any plans to actually share that my Allergy Power with the US?
Yes, we're really excited. We originated here in Australia, and we are partnering up with FAAPE. As you know, that's one of the world's largest non-profit organization dedicated to food allergy education, research, and advocacy. So we're partnering up with FAAPE to roll out Allergy Power in the US. We're hoping to make an announcement hopefully in the next few months. For any hospitals out there with an active allergy department, if you're interested to work with us through our workflow, we'll be very excited to partner up and collaborate. We think we're very excited about this interface between clinical research and innovation, and innovation needs to happen, and we need partners to work together.
Perfect. Well, Dr. Tay, good morning or good evening or good night. I have no idea which area you are right now. I hope that you're okay, and thank you so much for your conversation. And I want to share with everybody that please leave your questions on the bottom part. There's an area there. We'll actually make sure that our panelists we actually will collect the questions, answer them, and share them with you afterwards. We're running out of the times, and I really want to make sure that we finish with this with you. On the last 5 minutes, I want to recap with everything that we have seen. And I'm going to go from the innovation part to actually what actually moves us and puts us to work. We heard, the innovation part. We heard new programs, new devices, the integration of technology, and the important part of actually transaction of education, the important part of actually not just educating the doctors, but making sure that doctors understand what we're doing, and making sure that the guidelines are trickling down to the people that actually need it the most. Using innovative ways of seeing food as medicine, as something that can prevent allergies, early introduction of allergies, allergy stuff. And we heard, a couple of solutions from ReadySet Food, and making sure that there's ample distribution of this type of processes to underserved communities, that in the end, they are one of the ones that actually don't get all this information or treatments or opportunities to change everything. But most importantly, we need to remember that we're here for our families, for the people that we have lost, and actually all the stories that actually we heard right now that have been moving powerfully the conversation of we need to solve this now. In the old days, we didn't have a lot of tools. It was like just make sure that we if there's a problem, let's try to prevent it or treat it. Right now, we're moving to the phase that we can actually directly attack food allergies in a proactive manner. That way, we can start changing lives from birth onwards, because it's not just the child. The child will also become an adult, and the adult will also become a scientist, a lawyer, or someone else that actually will make a difference in our world. And thank you so much for actually bringing this innovation to us, having this conversation with us. Please do continue the conversation, because I'm sure that as we have heard from the foundations, we are just starting the conversation right now with everything that we have. And I'm very, very, very grateful with absolutely everybody that was here. And please, Mr. Becca and Michael, thank you for sharing absolutely everything that you have done. And we are sure that with this type of innovative panels and sharing information, we will be opening more doors and opportunities, and making sure that we continue protecting the most valuable pieces of our families. And I want to just, I don't know if Daniel is over there, if he wants to say something, and if not, I will be extremely grateful for everybody of you that has been here, and thank you so much. Thank you for coming.
Thank you.